All right, well, welcome to the annual open enrollment. It started Monday. So who's signed up already? No, that's why you're here. So this presentation, for those of you that don't know me, I'm Sherry Norman. I'm the director of the Senior Center, but I'm also a Shine counselor. And I'm passionate about the program, and I'm happy that Norfolk is allowing me to stay certified so I can help supplement our Shine counselors, who we're very fortunate. We have two wonderful women who work. One works the first and third Friday, and the other works the second and fourth Wednesday. During open enrollment, they're going to be expanding their hours, so hopefully if you need additional help beyond today, we'll be able to provide that. Who knows what a Shine counselor does? Here it is. So SHINE stands for Serving the Health Insurance Needs of Everyone on Medicare. Wow, that's a tall order. It used to be the E stood for elders, but we didn't like that. So now it's everyone on Medicare because, as you're probably aware, to be eligible for Medicare, you're either 65 plus, or if you've been disabled for 24 months, you can also be on Medicare. Most of the rest of the country calls this program SHIP, which would be State Health Insurance Assistance Program, which seems to make a lot more sense than SHINE. Although Florida also calls it SHINE, it makes a lot more sense for Florida than Massachusetts. But anyway, we're called SHINE. And what Shine counselors do, we're volunteers for the most part. Some of us do it in conjunction with our other duties at senior centers or our other community centers. But most people who do Shine are volunteers. Most of them are people who are recently retired, who have gone through the maze and come out the other side and said, well, I sort of get this. Maybe if I learn a little bit more, I can help other people. So if any of you are interested in being trained to be a Shine counselor after this presentation, I'm happy to speak with you. We're always looking for good people. But what's nice about Shine is we can provide unbiased insurance counseling. We don't get paid by any insurance company. We look at the whole range of programs for people. We, beyond just, you might just be looking for, hey, which is the best drug plan for me this year? But while we're sitting with our clients, if we screen you for income and assets, we can also look at other programs that you might be eligible for. Also, we can help with Medicare appeals and billing issues. It's really, I've been doing this for almost 15 years, and the job has gotten bigger every year. One year we went to a 2-day training program on long-term care insurance because they said, oh, well, this is a relatively new product. You might find clients who have this. And I walked out of there with my eyes glazed over with the guy's business card. I said, if I ever get any calls about long-term care insurance, I'm just calling this guy. Some of this, in addition to talking about changes for open enrollment this year, this presentation is also designed to be a review of Medicare 101. So if you guys are already Medicare 101 experts, please bear with us. Everyone knows the Medicare card changed a couple of years ago, so now you have a randomly assigned number as opposed to your Social Security number. For security reasons, I think the horse left the barn, but anyway, it's hopefully fixed now. And while we're on the topic, you also know that Medicare or Social Security will never call you. A lot of scammers out there, so don't ever give your personal information out over the telephone. We already talked about this in terms of Medicare eligibility. You have to be 65 plus if you've got your 40 quarters in, or the spouse of someone who qualifies, or if you're under 65, if you have a disability or a chronic disease, you could be eligible for Medicare. Enrollment periods, as we already talked about, we're in the open enrollment period, October 15th to December 7th. Every year you can make changes to your Medicare plans that will be effective the following January 1st. But we also have an initial enrollment period if you're new to Medicare. It's the 7 months around your birthday months, the 3 months before, the month of, and the 3 months after. Most people, for practical reasons, want it in place for the first of their birthday month, and it's better to apply before that because after that there'll be a lag in the coverage kicking in. The general enrollment period is if you missed your initial enrollment period, you have to wait till the following January through March, which will be effective the following July 1st. So that's, while it's really important to get it in place right away. or a qualifying event, if you move or retire, and we'll talk a little bit more about that in a minute. There are other special enrollments, which I always tell people, if you get stuck, that's why you call a Shine counselor, because there's a whole list of special enrollments that we could possibly help you with if you get stuck in the middle of the maze. So late enrollment. So there's, if you miss one of those other enrollments that you should have signed up for, there's a penalty, a lifetime penalty. For the B, it's 10% for every 12 months. For the D, the drug plans, it's 1% for every month that you for when you should have had a plan in place and you didn't. And that can be significant. So again, it's really important to try to sign up when you're supposed to, or if you're not sure, call a Shine counselor before you find out, oops, I missed a deadline and now I have a penalty. This sounds so simple. Medicare sounds so simple. A, B, C, D. What could be more simple than that? Right? So what's A? This is really a simple chart too, right? A is hospital. B is medical. Most people get that. Sometimes A and B together are called original Medicare. We're going to skip C for a minute because I think Medicare did. When the D plans, think D for drugs, when they came in I think 2006, who remembers? They went back and said, hey, we forgot C. So now they call the Medicare Advantage plans C. So that if you look at the chart that you have in front of you, 2 ways to get your Medicare. Sometimes I have you fold it in half. You either have original Medicare, A and B, or you have a Medicare Advantage plan. You can't have both. And we're going to talk a little bit more about that in a minute. But you also need the B premium, pay the B premium for either one of those. So what does original Medicare cover? A range of inpatient, outpatient, and home care services. It was never intended to be the sole source of coverage. Rough and tough, it's an 80-20 plan. The beneficiary pays 20% and the Medicare covers 80%. And it doesn't cover all services. So I apologize, but a lot of the Medicare rates are 2019 because we typically don't get the 2020 increases until about mid-November. But we know they usually don't go down, right? So the next thing I'm going to pass around, and most of you know this if you're already on Medicare, is the 2019 premium chart, which a few years ago that was indexed by income. But most people I know pay $135.50 a month for their Medicare B. The A, there's no cost for the A as long as you had your quarters in. The hospital coverage is free. Well, there's no premium for it. Nothing's ever free. And the B is this year, as you know, is $135.50, which comes out of your if you're currently collecting Social Security, it comes out of your Social Security check before it gets deposited. Don't even have to worry about it. They just take it from you. Isn't that nice? Isn't that convenient? If you've deferred your Social Security, you'll get billed on a quarterly basis for that. And typically, again, we don't have the 2020 rates yet, but we got what, a 1.6% Social Security raise or cost of living increase for next year. Is that correct? Is that what you heard? So typically, one hand giveth, the other taketh away. So you get a little bit of a bump in your Social Security, so there'll be a little bit of bump in your Part B premium. Is this making sense to people so far? Because this is the easy part, so I don't want you to get confused just yet, okay? So the IRMA, income-related adjustment amount, which is highlighted on that chart that just got passed around. If you are higher income, you pay proportionally more for not only your B premium, but your D for drug premium. Now, those are, if you're new to Medicare, they go back 2 years for your tax return. So I think that says that's 2019. So they looked at the 2017 tax returns to determine what your premiums are going to be. So we always get the question, but wait a minute, that's when I was working, when I was making the big bucks. Now I'm not making the big bucks anymore. So what happens? You have to apply for a reconsideration. There's a Social Security form, I think it's 44, that you have to submit to have people relook at your current income to reduce that premium. It won't happen automatically. What do you mean? What if I file my tax returns? Won't they just adjust that? No, you have to request that that get fixed. And the deductibles, again, these are 2019 costs. For A, if you go into the hospital and you have no other insurance but Medicare, $1,364 this year is the deductible. And for Part B, it's $135. And then your copays, as I said, are generally or co-insurance is generally 20% of the bill. Mary? Which I've only passed out 2 so far, so.
The one that you just passed out.
Where's the file?
Does anybody have? Is this stuck anywhere? Do we need more copies? We can get more. Okay, Stephanie's making more.
Thank you.
So the Part B premium, that $135.50 for most people. There are programs called the Medicare Savings Program or buy-in. And good news for 2020, those eligibility limits got increased. So for a household size of 1 or 2, these are the income and asset limits. If you're in that range, let's talk with a Shine counselor. We can help you apply to get that Part B premium paid for. Okay, this is where it's going to get a little bit trickier. All right, so the first page with the 2 sides, how do you get your Medicare? So you have on the left-hand side, I call that a la carte. You have your original Medicare, A plus B, a standalone Part D plan for your drugs, and then you have the option of purchasing a Medigap policy. Optional add-on, picks up where Medicare leaves off. There are 2 levels of that, which we're going to talk about in a minute. If you're at the higher level, it picks up the full 20% plus the deductibles that Medicare didn't pay for. So if you can afford it and you want full coverage, that's the way to go. Or you can get a Medicare Advantage plan, which are like HMOs, health maintenance organizations, PPOs, preferred provider organizations, which are as varied as the plans. The devils are in the details on those, and we'll talk a little bit more about those. How many people, just for show of hands, have a Medicare Advantage plan right now? Okay. And how many people are on the other side? And how many don't know? And how many are new? And does anybody need to go to the bathroom? Okay, we're good. All right, so now I will say this next handout talks about Medicare B preventive services, because and I talked earlier about Medicare being rough and tough, an 80-20 plan. There are some services that Medicare covers at 100%, yay! And this is the chart that's going around. They may not cover, I'm talking about the fun stuff, like colonoscopies, mammograms, all the things we want. So they're covered 100%. They may not be covered every year. They may be covered every 2 years. They may only be covered if you have a chronic condition, but they are covered 100% versus the 80. Not necessarily for Medicare Advantage plan. And we'll talk more about that in a minute. But there are some that are covered at 100%. And the other thing about Medicare Advantage plan, which those of you who have it know, your drugs are included in those plans. You don't have a separate drug plan. So over here, you actually need 3 cards. Your Medicare card, your drug card, and if you have a Medigap policy, your Medigap card. Over here, you have 1 card, and that stands for all of it. So other ways to supplement Medicare, we've already talked about a Medigap. Oh, I want to mention too, if you're new to Medicare, not all of the companies that offer Medigap policies, but most of them offer discounts for new beneficiaries. Medicare Advantage plans, if you're income eligible, Mass Health or Medicaid, those are terms that sometimes used interchangeable. All Medicaid means is subsidized Medicare, and in Massachusetts, the agency that implements that program is Mass Health. Retiree plans, does anybody have a retiree plan? Yeah, those have been going away for about 20, 30 years, but there's still some out there. What a lot of employers are doing is some sort of a subsidy. If you go through an exchange program, you have fewer options than if you were buying something off the shelf. But if you have a group employer plan, a retiree plan, it's whatever the company or the municipality or whomever you have it with has negotiated. So I never say I can find you something better or cheaper unless I actually look at that summary plan document that spells out exactly what you have and what you're paying for it. Typically, these used to be more generous than something you could purchase under Medicare. That's been gradually being eroded, but we'd have to look at the details to be able to tell you what might be better for you. Anybody use the VA healthcare system? For everything or just drugs?
Mostly drugs.
Yeah. So if you're a veteran, you have VA healthcare is like a parallel universe, but a lot of veterans used it just for the drug benefit. And then in Massachusetts only, we have something called Chapter 115 benefits, and this is actually the reason that town veteran services officers exist, to implement that program. It goes back to the Civil War. And if you're financially eligible for veterans and widows or widowers of veterans, you are eligible for some either a pension and or reimbursement for some medical expenses, depending on where you fall in the income chart. I thought I took this slide out. So not that you really care about this, but there's something called a MACRA. For practical reasons, what this means is that the Medigap policies, let me pass this around, and this one. We talked about the two levels of Medigap. Let me see if it's on the next slide. The core and the supplement one. So in Massachusetts, this is all we used to have. The core premiums start at $98 this year, $98.42 a month. The supplement one is this year starting at this is this year's rates, $197. So roughly $100 versus $200 a month for these plans. 7 different companies. However, they're standardized policies. And what that means is in order to sell this insurance in Massachusetts, you have to offer the same coverages. The only difference is what the companies charge you for it. So these are the lowest prices. This year, Blue Cross Core is the lowest. We have a new plan called, what's it called, Health New England. Yeah, they happen to be a few bucks cheaper than Blue Cross this year, although in the time I've been doing this, Blue Cross has been the lowest or one of the lowest plans. So unless you have real heartburn about Blue Cross, Shine counselors can never tell you what to do, but we always say, why would you pay more for the same insurance? So, yeah.
So are you saying that the Blue Cross Blue Shield Core and Supplement have cover the exact same thing?
No. So the difference between the core and the supplement one covers everything. The 20%, as long as it's a Medicare covered service, and Medicare doesn't cover everything, right? So typically Medicare doesn't cover routine vision, hearing, foot care, dental. So your supplement policy isn't going to cover that either. They're just going to pick up where Medicare left off. So Medicare is going to be the 80. If you have the supplement one, which is the higher level policy, they're going to pick up the 20%. The core picks it up after the deductibles. So those deductibles we talked about, that $1,364 for hospital, $185 for medical, you have to pay those first before the policy will kick in. When I was talking about the exact same coverages, all these companies that sell these policies have to offer you the same coverage. So it doesn't really matter if you have Blue Cross or AARP, except you're going to be paying more for the AARP/United, because AARP puts their name on it, but it's United Healthcare who's actually the insurer. So the good news about these, two things good news about these policies in terms of flexibility. So I see a client and they have, is United the most expensive one? Typically they are. So they come in and they'll say, well, I have the United Medigap, and oh, that must be the best because AARP puts their name on it. And I say, well, no, really, you're just paying more for the same insurance. So Good news, these policies are not tied to the open enrollment that we're in now for Medicare plans. They're private add-on insurance. They have something called continuous open enrollment, which means you can change them every month. And it's always effective. Anytime you make a change, upgrade, downgrade, add, drop, it's effective the first of the month following when you made the change. So we could take you off of United, put you on to Blue Cross, and you're saving, do the math for me, Carol, I don't know, $30 a month, something like that. Take yourself out to dinner, right? The only caveat to that is, unlike a Medicare plan, when you enroll in a new Medicare plan, a different Medicare Advantage plan or a different drug plan, for example, Medicare will automatically disenroll you from your old plan. You don't have to do anything. If you take yourself out of your current Medigap and sign up with a new one, you manually have to disenroll yourself from the old plan. Otherwise, you're going to be paying 2 bills, and nobody wants that. Does everybody follow me?
I just want to add that when if you're switching medical supplement companies, after your initial enrollment period of your Part B, you may be subject to medical underwriting after the initial enrollment of Part B. So that is also consideration. In other words, if your Medicare Part B is July 1st, and you're beyond that 6-month window of Part B, then you could be medically underwritten for switching a medical supplement plan. That's a consideration.
Okay, I'll have to do more, talk to you after about that because I don't know that.
What does that mean, medically underwritten? You gotta go through a physical?
Yeah,
No questions usually.
yeah,
Questions. For example, have you been recommended for a knee surgery within the past 2 years or any surgery that you haven't had yet? Things like that.
did that happen to you?
No, I'm not eligible yet, but I'm a licensed agent. So
Okay, all right.
I know this.
So all the more reason to sign up when you're supposed to. So the other thing about good news about the flexibility about when you can change. So let's just say you want to save a few dollars. Hey, I'm not going to go in the hospital this year. I'm feeling lucky, right? So I don't really care about that $1364 that's not covered under the core. Oh, okay, now I go to the doctor. Guess what? I need a knee replacement. Well, a knee replacement is something that you can schedule, right? So you call up, let's just say for purposes of illustration, Blue Cross. You have a Blue Cross. Blue Cross brand name is MedX. A lot of people have heard of this, right? MedX is the core. MedX Bronze is what they call their supplement policy. And you call up Blue Cross and you say, I want to upgrade to the Bronze for next month. They say, fine. So then you call and you say, all right, now I want to schedule that knee replacement for, whatever, 2 weeks into the new month. And you get that hospital deductible covered. Or are they kicking you out? Are they doing knee replacements same day now? I don't know. Oh gosh. Well, let's say it's something else where you actually have an inpatient hospitalization. Which, just a note on inpatient, did anybody ever come across anything about observation status? Okay, so observation status is not a great thing. This is probably 5-6 years ago they started doing it. They'd put you in, you'd be in the hospital, you thought you were admitted, and then you found out later that you weren't really officially admitted. You were only in under observation status. And that becomes an issue if you have to go to rehab after, which is typical, right? You have a surgery, you're in the hospital for, whatever, a few days, then you go to rehab for a period of time. So if you aren't in an inpatient status for 3 days, Medicare won't pay for your rehab. If you're on this side, the left-hand side, Medicare Advantage plans, there is no 3-day stay. But people would find out the hard way. They'd, get this big bill for rehab, and they said, why wasn't that covered? Oh, you were in under observation status. So the best that advocates were able to do on that is now you have to sign off to say, I know I'm in under observation status. But still, you're in the hospital, it's a stressful time. If you can't advocate for yourself or you don't have somebody who's advocating for you, just be aware from a consumer practice. You want to be admitted. You want to tell your doctor you want to be admitted.
But this 3 days, it's 3 overnights, and you need to pay attention if you get into the hospital after midnight.
Yeah.
That's also detailed.
Right. Yeah. Mm. So the other lesson there is don't get sick, I guess.
From a logic standpoint, you've got you would select a plan based on the rate. What is there an advantage to pay, United Healthcare is $234. Is there any advantage to the other plans?
I can't see any advantage because, again, they're standardized policies. They have to offer you the same basic levels of coverage. Now, they might throw in some extras. This is also something that's been happening more. There used to be a bigger distinction between a Medicare Advantage plan and a Medigap plan. So Medigap, one of the advantages of a Medicare Advantage, one of the advantages of a Medicare Advantage plan is they're going to pay for some of those extras that Medicare doesn't normally pay for. And again, depending on the plan. It's not going to be a whole lot. And we'll talk about this more when we talk about Medicare Advantage plans. But, some routine vision, some routine hearing, maybe some dental, maybe a fitness benefit, maybe a smoking cessation or weight loss thing. So, but more and more, the Medigaps are throwing a few of those in. But I wouldn't say a substantial difference. It really comes down to going with the cheapest plan.
Medicare does have a healthcare, deduction that they'll pay you back, not a deduction.
Right, a reimbursement for fitness programs. Yes, true. So, but I would, I guess, easy answer to that is no. Go with the cheapest plan. Unless, like again, this year, that Health New England's undercutting Blue Cross by a couple of bucks. If you're already in Blue Cross, is it going to be worth it for you to? That's up to you. I would say no, but new beneficiaries, however, that Health New England plan. Previously I talked about the discounts for new people. So Blue Cross is, because it's one I'm most familiar with, it's a graduated discount for new beneficiaries. It's 15% the first year, 10% the second year, and 5% the third year. I understand that Health New England is offering 15% for the first 2 years. So if you're a coupon clipper like me and you're new to Medicare, you may want to do Health New England for the first 2 years and then see who's the cheapest the next year. I think you have to be in it for the full 2 years to get the break, but we're talking about sort of insignificant amount of money if you're talking about just doing it for the discount. But that's the only difference really is the cost for the standardized benefits. Foreign travel is another one. Not all of them include foreign travel. However, if that's important to you, you'd probably look for that.
Medic Bronze does.
Yes, Medix Bronze and Core. So that scenario that I described to you about the voluntary surgery, and you're going to start with Core and then upgrade and get your hospital deductible covered. We used to say that to people about foreign travel. Well, start with the Core, and then you hit the lottery, you want to take that trip. Okay, upgrade to the Bronze or the Supplement 1 if get that foreign travel covered. So we must have said that enough times that Blue Cross. I think Blue Cross started it. Now more companies have followed suit. I'm not sure if it's in the bottom of that. Which ones offer it, which ones don't. But they must have said, for the number of people that can take advantage of this, from a marketing standpoint, let's just throw it into the Core too.
Yeah, Tufts did not.
Yeah. So that might be another factor that you would look at if that's important to you. However, usually they follow suit because it's let's face it, it's a competitive market. It's a lot of money to be made, right? So that's typically what they do. So something new this year. This shows you, it's the back of the form that you have, what's covered, what's not. We've already talked about this. So what's not covered under the Core are those deductibles. The hospital deductible, and again, these are 2019 costs, the Part B deductible, and also skilled nursing. So Medicare pays in full for days 1 through 20. After that, days 21 through 100, there's a $170.50 co-insurance this year for rehab. Got to be in bad shape to be in rehab for 3 weeks or more. It could happen, but most of the times they're kicking you out before that, right? And then you can always upgrade, right, to get those additional days covered if the timing works out, depending on where you are in the month. But in any event, that's kind of a lower risk. You're going to be on the hook for that 185, right? You're going to go to the doctors at least once. That first 85 is going to be on you before the 20% will get picked up. The hospital deductible we've already talked about. You can maybe play with that, if it's a voluntary reason you're going in. And, the skilled nursing is could happen, but it's, it's all about risk management. I always say 3 things you have to consider when you're trying to decide what insurance to get. What can I afford? What's my health? How often am I going to use this insurance? And what's my comfort level with risk? So you have to weigh all those and then throw a dart and decide which one you're going to buy that year. I mean, hopefully it'll be more than a dart. I'm giving you information so you don't have to go with the dart method. But what's new this year, that goes back to that macro slide, which I'm going to have to take out. I thought I already took it out. For beneficiaries eligible for Medicare after January 1st, 2020, they're no longer going to be able to purchase the Supplement 1. So there's a new product, Medicare Supplement 1A, and Blue Cross is calling it Sapphire. So you go from bronze to sapphire. I don't know, I think sapphire is just more valuable than bronze, but I don't know. Anybody know? So I don't know if this affects anybody in this room. And it doesn't also mean when you take your Medicare. So for example, my husband's Medicare eligible this year, but he's not going to take it because as long as you're covered under group employer plan, you can defer picking up your B, right, until you're no longer covered. But because he's eligible before January, if he wanted to buy the Supplement 1 down the road, he could. But anybody who's eligible after January can't buy it. So they have to go with this new plan. Now the difference from a cost standpoint, is that on the chart?
Yes, 177.
Yeah, so it's actually cheaper probably, right? If you figure it out, what it doesn't cover is that B premium, the $185. So even if you had to pay that out of pocket, your monthly premium's, about $20 different,
$240 break even.
Yeah, so you may want to just go with that, right? All right, so that's Medigap, and not cutting drugs yet. Drugs is another whole discussion, but so that's the Medigap. Any questions about Medigap before we move on to Medicare Advantage plans and Part D standalone plans? What a good group. Is it because I'm explaining it so well, or you just knew all this already? Okay, who has Medicare Advantage plans again? All right, so sometimes called C. So these work differently. Now, one of the things that's confusing about Medicare is it all sounds alike, right? All the names of these plans all start to sound like a big alphabet soup. So because it's the same companies that they're going to be selling you Medigap or they're going to be selling you a Medicare Advantage plan. The difference is the way they contract with Medicare. So they pretty much say, okay, this is what we're going to, and they can, within certain parameters, they can throw in some of those extras. And they can say, they get a certain amount of money from Medicare for each of their members. And they can say, okay, this is how we're going to spend the money. So you're all over the place, depending on the plan, depending on the services. I always tell people the way you narrow this down is to check with your providers. That's assuming you don't want to change providers. If you don't care, then it's wide open. I can't help you narrow it down. But typically, most people want to stay with their doctors. So they go to their doctor and they say, okay, I'm considering a Medicare Advantage plan. I'm considering changing to a Medicare Advantage plans. Which ones do you accept? I typically say, ask the billing person because they know. If you ask anybody, they may say, oh, sure, we take Blue Cross, we take Tufts. Well, that could mean, 10 different plans. It could mean their Medigap. It could mean one of their, other Medicare Advantage plans. And then you need to do a little bit of homework on this side of the equation. You need to do the math because this is more of a pay-as-you-go kind of a plan. So typically, and there's another slide that talks about the differences, the advantages and disadvantages with going one way or the other. But typically the premiums are lower for these plans than the Medigaps that we were talking about. However, you can purchase a Medicare Advantage plan that has a higher premium than the Medigap plans. The drugs are embedded in this plan, which again is some people like that. I don't want to have to pay 2 bills. I want to have just the one card that means everything. But that's another thing you need to check if you're going with a Medicare Advantage plan. Which tiers what's your formulary? Are my drugs covered? Number one, what tiers are they covered on? And then you really kind of have to crunch the numbers. You know, on any given, you know, nobody knows what's going to happen. Hopefully that bus doesn't come around the corner. But based on, you know, how you use the healthcare, your healthcare today, how many times do I go to the doctor? Do I see a specialist? You know, am I going to be needing a surgery? So you really have to do a little bit of analysis and a little bit more over on this side of the equation. The disadvantage to Medicare Advantage plans are less flexibility than on the other side. So if you're an HMO, you have to stay in network. PPO, preferred provider organizations, you can go out of network. Typically, you're going to be charged more if you do. However, there's a couple of plans where that doesn't happen. But you definitely have less flexibility over here. With the Medigap or original Medicare, you can go anywhere in the country, anyone that accepts Medicare. If you have the supplement plans that cover outside the country, that'll also cover you. You don't have to get referrals. You can see any provider that accepts Medicare, and we haven't met one yet. I remember a few years ago there was one physicians group that wasn't going to take it, and then they came to their senses. So Medicare Advantage plans, you know, right now we're in open enrollment, so you could make a change to a plan that's effective January 1st. But last year they added, I don't know what they called it, special enrollment, but between January and March, there's a special Medicare enrollment. But the way I look at it, it's just like one long enrollment, right? You can make a change now for January 1st, or you can make a change again, you know, January 1st to March 31st. But between January 1st and March 31st, you can only do that once. So right now, if you were to choose a plan today, and then you decided between now and December 7th you didn't like that plan, you changed to a different plan, it's whatever the last one you're in for January 1st. But if you take advantage of this Medicare Advantage special enrollment period, you only get one shot at it between January 1st and March 31st. You could also change back to original Medicare. You could say, you know what, I signed up for a Medicare Advantage plan, but not sure that I want a Medicare Advantage plan. Then you can go back to original Medicare during that time period, January 1st to March 31st. Is that clear as mud? That's good. Okay, so this is the Medigap versus the Medicare Advantage plans. Again, we talked about typically you have generally lower premiums and copays with Medicare Advantage plans, but the downside is you have more restrictions than with a Medigap, referrals, the routine services, and the portability. So those, you know, you kind of have to weigh all that based on your personal circumstances. So typically if somebody comes in to see us and they say, you know, I spend 3 to 4 months in Florida, Medicare Advantage plan's probably not going to work as well for you, right? So they have to take you in a true emergency situation, but if you get, you know, I don't know, some sort of, give me a thing that might happen to you, pneumonia, I don't know, heaven forbid, they're not going to be able to help you for routine care. So typically, maybe a Medicare Advantage plan is not a good decision if you spend a lot of time out of the area. All right, we're talking about drugs now. All right, so the drug, I'll just say this right up front. The drugs plans, the whole thing is broken. Our system is broken. It's a big shell game. Every year, if something's going to change during open enrollment, it's going to be the drug plans. Which plans, how many plans, the formularies, what tiers they have your drugs on, the cost. Let's just throw it all up in the air and see what, you know, sticks. This year, it's further complicated because the tool, has anybody used the Plan Finder on the Medicare website to determine which drug plan is best for you? Have you used it this year?
Not yet.
Okay, so what they did was they totally changed the Plan Finder. And not for the better. And so one of the things we used to do when we do drug searches for people or train you how to do your drug search, because it never used to be that hard, we could do generalized searches, right? And we did that a lot because of the volume of the people that we have to deal with. Well, there's something called My Medicare. Does anybody have a My Medicare account? Okay. So this is something they put into place years ago, but not that many people took advantage of it. Well, now they're sort of forcing you to do it. In order to be able to save searches, in order to be able to do a number of things, you really have to have a My Medicare account. So it's going to make it, more challenging for Shine counselors because we're going to have to you're either going to have to set that up beforehand, or we're going to have to help you set that up, and it's going to take longer. But we're going to do the best we can. I was trained on Tuesday, and there were 50 of us in the room, and there was a lot of whining about it. But we're gonna make it happen for you. Don't worry.
It's easy to set up though.
It's easy to set, well, for you, because you've already done it, and I'm guessing you're tech savvy, where there's a lot of our beneficiaries are not. So it's just going to be a little bit more time consuming for us to help people find a new drug plan. But we always also say, the Medicare Plan Finder, even the old one, which was better than the new one, we always, we'd find mistakes. And so we'd always say, hey, look, here we're recommending this, 1 or 2 or 3 plans, typically not one, unless it's really clear, like if you don't take drugs and you want to go with the a la carte, you're going to go with the cheapest plan. But we'd always give people some options and say, based on your preferred pharmacy or a few particular brand drug that's only going to be covered under a handful of plans, we'd say, here are your options. Make your decision. We can't, everybody says, oh, just tell me what to do. But we can't really do that, but we give you information to hopefully help you make an informed decision. So just, I guess, be patient. It's going to take a little bit of time for sort of us to get used to the new tool. If you are using a Shine counselor and you can set up a My Medicare account beforehand, that's going to be really helpful. We also have the pre-enrollment forms. I don't know if you've used Shine counselors in the past, but that's really helpful. The more information we have up front before we meet with you, the more efficiently we're going to be able to assist you. But the Part D benefit. So this is the standard benefit, and it's the same whether it's a Medicare Advantage embedded in the Medicare Advantage plan or if it's a standalone plan. 2019, the deductible was $415. 2020, it's gone up to $435. Now, that's the most a plan can charge you for deductible. They don't all charge the full $435, and most of them also don't apply to the deductible to the Tier 1 and 2 generics. The deductibles only apply to the expensive drugs, Tiers 3 through 5. Initial coverage limit. So this is where you get into the donut hole or the gap in Medicare D coverage. Once you've hit this year $4,020 in retail costs, there's this magic number that people say, this is the full retail cost of that drug. Once you hit that number, you're in the gap. Now, the good news is the gap has been closing. We used to be told it was going to be gone by 2020. That's not true anymore. But if you do get in the gap, it's not always bad news because you get 25%. Oh, that's wrong. You don't get 257%.
Yeah.
Another edit. You get 25% covered for either brands or generics this year if you hit the gap. Until, heaven forbid, any of you are in the category where you get to catastrophic, then it flips and you actually, the plan only pays 5% and the plan pays the rest, and you're not going to pay more than $360. That's a 30-day supply for generic, or $895 for a brand. Not that, I wish any of you ever to get to catastrophic coverage. There's also something called Prescription Advantage in it. Does anybody have a Prescription Advantage? Know what it is? Okay, Prescription Advantage is Massachusetts' name for a state pharmacy assistance plan, and it's a wonderful program. For most people, there's no cost to get into it, and it does assist you, especially if you get in the gap, with gap coverage. The other thing that's great about Prescription Advantage is they only look at income, not assets. It's a very simple application. You can apply on the phone, online, in paper. We can help you do it. And it's continuous enrollment, so you can get in at any time, effective once they get the complete application. It's effective the first of the month after. The other thing that's great about Prescription Advantage is just by being a member, you get a special enrollment. So one other time outside of the normal, during the year. So you make a decision now for January, then something happens. Hopefully the plan didn't change on you, but maybe you're on a new drug that you weren't on now. And your plan isn't working. With Prescription Advantage, we can use a special enrollment to change your plan outside of the normal open enrollment cycle. So if you're not on Prescription Advantage and there's no cost for you to join it, just do it. It's like having your little get-out-of-jail-free card in your back pocket in case you did need a special enrollment. Worst case, you'd have to apply and wait a month to get the benefit, but it's a really good program. All right, so how do I choose my drug plan? Well, 9 companies, 25 plans this year. We lost a plan. Last year was 26 plans. Shine, we've already talked about how we can help you. Medicare will help you if you call Medicare and try to get through. They're open. No, they're open. They're good. You just don't call during peak times. Maybe I don't know, Sunday night at 11 or something. And 1-800-Medicare. It's actually Medicare without the E. Is 633-4227. They'll do a search over the phone with you. A lot of the Mass College of Pharmacy Outreach Program. That's actually a great resource for difficult situations. You've got a really expensive drug, or you've got another just an oddball question about medications. The outreach program is a wonderful resource. Some pharmacies offer help with finding drug plans. So there's a lot of different ways to try to find which drug plan works for you. And what's the best plan? It's always the plan that covers your drugs at the lowest cost. So it doesn't matter if your neighbor likes XYZ plan. Unless you and your neighbor are taking the exact same meds, that plan might not work for you as well as another one. Preferred pharmacy, that's another thing that's an issue. So in addition to negotiating costs with Medicare, and there's all these middlemen that need to take their cut, which is one of the reasons why prescription drugs is so expensive in this country, don't get me started, there's this thing called preferred pharmacy pricing, where the big pharmacies are negotiating preferred rates. So even sometimes just by switching drugstores, then we can save you money, which is one of the reasons on the pre-enrollment form we ask you which pharmacy do you use now and would you be willing to switch, because sometimes the change can be significant just by going down the street to a different drugstore. Lynn?
Walgreens, Norfolk now is covered under Blue Cross Blue Shield as a preferred. They have never been.
Well,
And it made a difference of $1,000. We had to go to CVS last year, not our preferred place.
yeah.
But we had to go to CVS in Walpole, because between us, it was gonna cost us 900 and something, almost $1,000.
Yeah.
Because of what she's saying. So it's not just a little bit.
Yeah, it can be significant. Ellie? Mail order, so the mail order, they contract with third-party companies, and you used to be able to save a lot more with mail order, so it's worth looking at. Again, that's sort of a personal thing. Some people love mail order, some people don't. VA only uses mail order, right? So the disadvantage is if you order a 9-day supply and you get a change, you're not on that drug anymore, then you've paid for something you're not using. So that's really a personal decision. I mentioned Prescription Advantage. Not all mail orders work. So Prescription Advantage, if you apply for that, you get another card. You take it to the pharmacy. If you buy retail, that's tracked automatically. So they know when you're in the donut hole and you're automatically going to get that assistance that I talked about. If you're doing mail orders, some of the mail orders sync with Prescription Advantage. Some of them you may have to do a manual reimbursement if you do decide to use Prescription Advantage. But that, again, it's sort of a personal choice. And I think all the plans offer mail order this year. Sometimes there's been years where some companies haven't had mail order. Okay, anything else about, yeah?
You know how you pay the $185 a month for the A and B?
$135.50 for the B, nothing for the A.
Okay.
The $185 is the annual deductible for the B. You have to, if you don't have another insurance, you have to pay that first.
Right, so the $135 you pay a month. Now on the D, in 2019, we're paying $30.70 a month, the D.
It depends on the
It
plan.
goes up to 40.
If you have an Advantage plan, you still pay the D.
So the Advantage plans, the cost of the medications are included in your monthly premium.
But you still pay Medicare, the D
No.
plan.
No, you still have to pay the B, regardless if you're having a Medicare Advantage plan or a Medigap. That $135.50 or whatever it's going to be next year comes off the top. So that's the same. The D for drugs, if you have a Medicare Advantage plan, the cost of the drugs is included in that monthly premium. You wouldn't pay a separate premium as you would if you had a standalone drug plan.
Okay, because that standard one is gonna double next year.
The standard what? I'm sorry.
The,
I'm sorry, I don't understand the
you
question.
know, at the end of the year, you get that slip that unfolds and tells what you pay.
Your statement from the drug plan?
No,
Is that what
from Medicare.
Oh, okay.
And it tells you what you're paying each month for A and B, what you pay for
Yep,
B.
yep.
That D that I have now is going to double next year.
Well, if you have a plan, well, you can talk after, but if you have a plan that the premium's doubling, then we should talk and find you a different plan. Because, you know, chances are there's a cheaper plan. The plans this year, I think they start at 13 and change for the cheapest plan for a monthly premium, and then they go up from there. And again, just back for a minute to talk about the drugs. Even if a plan has a deductible, like always, a lot of people say, I want a plan without a deductible. Which again, the advantage of that is you don't have to, pony up the big money in the beginning of the year. But remember, for most of those plans, that only applies to the higher tier drugs. So if you take in the cheap generics, don't necessarily worry about that deductible. But sometimes, even if there is a deductible, if you look at the cost over the whole year, that still could be the most affordable plan for you. So don't shy away from a plan just because it has a deductible.
I just want to say, for those people that feel comfortable with the technology, if you go on Medicare.gov and you create that account, you can input your prescriptions exactly as they are, now, the type of prescription, the quantity, and the dosage. And then that'll take the guesswork out of figuring out what the least expensive or what your overall costs are going to be if you consider those plans.
Yeah.
Because the analyzer goes from least expensive, including the premium and the projected copays, to the most expensive. It ranks it.
Have you used the new Finder yet?
No, you say it's not easy?
It doesn't work like that anymore. It won't even give you the annual cost. I mean, we can figure it out. It's just going to take a few more steps than it used to. Hopefully they'll change it back. Sometimes, improving things, fixing things to make them better it doesn't make it better. Believe me, they've been hearing loud and clear. There are some glitches that people found months ago when they were testing this that supposedly have been fixed by now. I haven't had a chance to play with it yet. Frankly, I've been a little afraid. But I'm going to do it right after this. But no, it's not as easy as it was. But once you get your arms around it or have somebody help you, that is really the best way to find out. And there's a lot of different analyses you can do to play with it. When you're going to be in the donut hole, looking at, costs from pharmacy to pharmacy. So it really is kind of the only way to do it without, unless you're a super brain, you can, keep all that data in your head and figure it out. So other programs, if you need help with the costs and you are eligible, most of these programs look at both income and assets, except, as I said, Prescription Advantage only looks at income. We talked about the pharmacy outreach program for Mass College of Pharmacy. Extra help is the benefit under Medicare, a federal benefit that helps people with their some costs related to their drug plans if you're eligible. We've talked about the buy-in, which is the program that covers the B premium. Mass Health programs, there's a variety of them. We can screen you for the different programs. Health Safety Net is one of the programs under Mass Health that has higher income guidelines, also doesn't look at assets. And what's nice about the Health Safety Net is if you're eligible for it, you can get that Hospital A deductible picked up. So sometimes if people are eligible for that, then it's more of an, I was going to say no-brainer, but it's more attractive to take the core Medigap because the biggest exposure under that is going to be that hospital deductible. So if you're eligible for Health Safety Net, you can get that picked up. That also works with a Medicare Advantage plan. Now, Medicare Advantage plan, remember, you're not going to have that $1,364. Depending on the plan you have, you might have a $250 a day coinsurance for the days you're in the hospital, but it would still help pick up your hospital costs. So if you think you might be eligible, talk to a Shine counselor. All right, so the questions you ask yourself for open enrollment. Does your type of plan still work for your health and finances? Yes, no. And even if it's yes, you want to take or have somebody take a fresh look at it because something might have changed on you. So who's getting inundated with mail? Right? So your plan has to tell you all the changes that they've made by law, but then all the other companies, right, want your business. So you're getting like inundated with all this marketing material. Radio, TV, it's like, so what do? Shut it off, turn it out, throw it in the trash. But you don't want to get surprised in January that something changed on you. Oh, I'm just going to stick with my insurance company. It's working fine. Well, let's hope it's still working fine. So take a look at it or bring it to a Shine counselor to take a look at it for you. Compare the costs and coverages, your drugs formulary, the preferred pharmacy changes, which we already talked about. If there have been network changes, it's not just doctors, it's hospitals, it's any kind of a service that you might use is going to have a network, and there could be significant out-of-network costs for you if you're not paying attention. So if you decide to stay with your plan, you don't have to do anything. Come January 1st, you'll have the same plan you have now. And if you decide to switch, you can either do it with Medicare or with the Shine counselor. As I said before, if you're switching Medigap carriers, you have to manually disenroll yourself from the old plan before you're in the new plan. All right, questions? Everybody thoroughly confused? Okay. Well, my intent is to try to answer some basic questions or get you thinking about something you haven't maybe weren't aware of before. But the good news, as I said, is we have 2 great Shine counselors. They have expanded their hours for open enrollment. Also, you could also call HESCO. Does everybody know what HESCO is? It's our senior, this is alphabet soup, ASAP, area, what does that stand for? Aging Access Point Service, blah, 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 blah. HESCO stands for Health Education Social Service Consortium. We're one of the 12 towns under the HESCO umbrella. Our regional Shine office is located there. Shine volunteers are there every day. I don't know how they do it over the phone because, as you can see, I'm drawing pictures and using my arms and pointing, and I'm still not sure people walk out understanding what I just said. But they do phone counseling. You can also send your drug searches, into them. Our 2 Shine counselors are doing their own drug searches. So if you want to meet with a Shine counselor here, don't send it. We have the forms at the front desk. Don't send it to HESCO. Keep it in. We're going to keep it in house, especially with this new plan finder. We want to keep control over it. The Medicare Advantage plans, as I said, I do have. The best thing to do is to narrow it down, as I said, looking at the providers or. But the other thing you could do is go on each of the company's websites, and they all have really nice side-by-sides where it can help you do your individual analysis based on your personal needs, both from a health standpoint as well as a budget standpoint. And you just make the best decision you can. And remember, you can always change it, right? We have all these, you can change it next year. We have all these different special enrollments that we possibly could change if your situation changes. So sometimes you just have to make the best decision you have with the information in front of you at the time and, deal with whatever life may throw your way after that.